Today I want to talk about help for MND patients, motor neuron disease patients in regional and rural areas in Australia. Stay tuned. My name is Patrick Hutzel from intensivecareathome.com, and this is another video podcast today. So a couple of weeks ago, I went to a conference in Adelaide, a respiratory conference, and I was talking to a physio from a regional hospital in somewhere very regional and remote in Australia. And she was telling me that they have an increased number of MND patients coming to their hospital. And, that hospital is 12 hours away from Sydney. It's about 15 hours away from Melbourne. So it's very regional and they have very limited resources. And, a lot of MND patients, as they unfortunately progress in their disease and their disability, need BiPAP, they need cough assist machines, and in that regional center they're covering a large catchment. Some catchments also 12 hours away from the hospital. And she says there's one cough assist machine to cover a large area, within a radius of basically 12 hours, and that is just not good enough. And she says that MND patients simply die because there's no treatment, no equipment, no nursing services, no nothing, and that she said it's very sad to watch. And what can be done about it? Well, the first thing that can be done about it is, most of those MND patients would be eligible for NDIS funding. That is, if they are below the age of 65. If they're above the age of 65, currently they could only go on the aged care package, which is very limited, but that's also something that needs to change in the future, because the advocacy for aged care recipients need to gain some speed, because the aged care system really needs a similar system to NDIS, where clients and patients can get what they want according to their disability or diagnosis. But to illustrate what's happening in metropolitan areas like in Sydney, Melbourne, Brisbane, Adelaide, Perth, patients can usually then go home with BiPAP, cough assist, or even with a tracheostomy, because they can get nursing services like intensive care at home. And it's very sad that the infrastructure in regional areas is simply not there yet, but can certainly be established. And here is how. When you look at the NDIS price guide, you will find things that there's funding for remote and regional areas, and we have certainly done that for some clients where we have staffed 24-hour rosters for remote and regional areas for critical care patients in the community, and whilst that might sound far-fetched for anyone that's in such a difficult situation, it's definitely possible. It's definitely possible, and that's also why we employ our own NDI support coordinators to help you with funding. We're doing a lot of pro bono work there, to help our clients with funding, as long as it's clinically justified, of course, to need 24/7 critical care nurses. But the reality is, for someone with motor neuron disease that either needs cough assist, needs BiPAP, needs tracheostomy with ventilation, needs critical care nurses, which is evidence-based, so there is help at hand. So if you are in regional or rural Australia and you're struggling with services, you should reach out to us. And also for the hospitals, if you're struggling with looking after these patients in hospital because you don't have the beds, you don't have the skills, you don't have the equipment, please talk to us. It can all be organized, whether it's equipment, whether it's skills. That's what we do all day, every day. And the location doesn't really matter, as long as we can advocate for the right level of funding. Location doesn't really matter. And the NDIS is there to facilitate your care. Or if you're a hospital watching this, or you're discharged from hospital, we can work with that. And we have worked with that many, many times. So know that there's help at hand, know that there's hope, and please reach out to us here at intensivecareathome.com. So with intensive care at home, we are currently sending our ICU and critical care nurses into the home 24 hours a day. Therefore, we are providing a genuine alternative to a long-term stay in intensive care for ventilation, tracheostomy, home BiPAP, home CPAP, ventilation without tracheostomy, tracheostomy care without ventilation, home TPN, home IV potassium and home IV magnesium infusions, IV fluids, and IV antibiotics. We're also providing cough assist management at home, ventilation weaning at home. We're also providing central line, peak line, Hickman's line management, as well as port management at home. We're also providing nasogastric tube and PEG tube management at home, as well as palliative care services at home. We're also sending our critical care nurses into the home for emergency department bypass services. We have done so successfully as part of the Western Sydney Local Area Health District, their In Touch program, saving approximately $2,000 per patient that we keep at home instead of them going to emergency departments. That means we're also in a position to cut the cost of an intensive care bed by around 50%. An intensive care bed costs between $5,000 to $6,000 per bed day. Intensive care at home costs between $2,500 to $3,000 per bed day. And we're freeing up the most sought after bed in the hospital, which is the ICU bed. Most importantly, we're improving the quality of life for patients and their families, which is a win-win situation for all stakeholders. With intensive care at home, we're currently operating all around Australia in all major capital cities, as well as in all regional and rural areas. We're an NDIS approved service provider all around Australia, TAC and WorkSafe in Victoria, iCare in New South Wales, NIISQ, as well as the Department of Veteran Affairs all around Australia. Our clients and we as a provider have also received funding through public hospitals, private health funds, as well as departments of health. We are currently the only service provider in Australia that has achieved third-party accreditation for intensive care at home nursing in 2025. We have been achieving this level of accreditation since 2012. No other service provider has achieved this high level of accreditation in the community and has created more intellectual property for intensive care at home nursing than we have. This puts us in a position to employ hundreds of years of critical care nursing experience combined in the community. No other service provider in 2025 employs a higher skill level in the community than we do, and that enables us to look after the highest acuity adults and children in the community in Australia safely. And if you're at home already and you're watching this, or if you're stuck in an ICU long term and you realize that you need to get out of ICU or you don't have the right level of support at home, I'll help you understand and give you a very tangible and real world example today how we have helped clients to overcome such challenges in the past. One of our first clients when we first got started in 2012 was a client who was at home initially on a ventilator with a tracheostomy with a support worker model 24/7. Of course, disability support workers are dangerous looking after a ventilation and tracheostomy client, and it's negligent having disability support workers look after a client at home on a ventilator with a tracheostomy. That is like flying the airplane with the cabin crew instead of the pilot, because many patients in the community on a ventilator with a tracheostomy, even a tracheostomy without a ventilator, have died under a disability support worker model. And I can confirm that I have evidence for everything that I'm saying here. Therefore, anyone on a ventilator with a tracheostomy is at very high risk of medical emergencies, or even worse, if they don't have a stable team of critical care nurses looking after them 24/7. This is also actually evidence-based in the community, and it's documented in our mechanical home ventilation guidelines that you can find on our website at intensivecareathome.com. Think about it. In an intensive care unit in a hospital, you wouldn't have support workers looking after a critical care patient on a ventilator with a tracheostomy. So why would anyone in their right mind do that in a home care environment in the community? So eventually, this client, but also the funding body and also the ICU that this client was living in, found out about our service, and they reached out to us, and we were proving our concept with this client very fast. When we took him home from ICU on a ventilator with a tracheostomy, we sent him intensive care nurses 24 hours a day, and he never ever went back into ICU ever again when we were proving our concept there with this client. We can do the same for you if you're not safe at home or if you're stuck in an ICU long term, which includes the advocacy for funding that goes along with it, which ties in with today's topic. We have always successfully advocated for our clients. Otherwise, we would not be in business. The same applies for those stuck in an ICU, similar to our other cases to what you're looking for. So please reach out to us as well. We'll make it happen for you as well. We can take you through the right steps. And this is also why we're providing level 2 and level 3 NDI support coordination. We have a team of NDI support coordinators, and they have a wealth of knowledge. I've done an interview with Amanda Richards, one of our NDI support coordinators, and I'll put a link to an interview with Amanda in the written version of this blog. We're also providing TAC case management and WorkSafe case management in Victoria with Lucy McCotter. And if you're an NDI support coordinator or a case manager from another organization watching this and you're looking for nursing care for your participants, please reach out to us as well. If you're looking for funding for nursing care for your participants and you don't know how to go about it and what evidence to provide, I encourage you to reach out to us as well. We will help you with the right level of funding and with the right level of advocacy. We're also providing NDI specialist nursing assessments done by critical care nurses with a legal nurse consulting background. And if you are a critical care nurse and you're looking for a career change from a hospital and you want to join a very progressive, dynamic, high-performing team of critical care nurses in the community, we are employing hundreds of years of critical care nursing experience combined. If you are looking for a career change, we're currently hiring for jobs for critical care nurses in Melbourne, Sydney, Brisbane, in Albury, Wodonga, in Bendigo, in Geelong, and in Warragul, in Victoria. If you have worked in critical care nursing for a minimum of 2 years, pediatric ICU ED, and you have already completed a postgraduate critical care nursing qualification, we will be delighted hearing from you. I have a disclaimer because we are offering a tailor-made solution for our clients, which includes regular staff. Our clients also do want the same staff coming over and over again because they are very vulnerable and very special, and that's why we need regular staff. So if you're looking for agency work where you can come and go, this will not be the right fit for you. We're looking for consistency, and our clients are looking for consistency. So please only apply with us if you can give us regular and consistent availabilities for shifts and if you're really keen on building relationships with us and with our clients. If you're an intensive care specialist or an ED specialist, we also want to hear from you. We're currently expanding our medical team as well. We can also help you eliminate your bed blocks in your ICU and in your ED for your long-term patients or for your regularly readmitting patients with our critical care nursing team at home. We're here to help you take the pressure off your ICU and ED beds. And in most cases, you won't even pay for it. Even if you do pay for it, it is much more cost effective than what you're paying for in ICU and ED, and you get the same level of care. And if you're a hospital executive watching this and you have bed blocks in your ICU, ED, and respiratory wards, home TPN, please reach out to us as well. We can help you eliminate your bed blocks very fast. If you're in the US or in the UK and you're watching this and you need help, we want to hear from you as well. We can help you there privately with one-on-one consulting and with hiring nurses privately. Once again, our website is intensivecarehome.com. Call us on one of the numbers on the top of our website or simply send us an email to info@intensivecarehome.com. If you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell. Share this video with your friends and families and comment below what you think about today's topic and what you want to see next. Thank you so much for watching. This is Patrick Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.